If you can describe what exactly is a sports medicine doctor and what a typical day is like for you.
It's kind of confusing. It's almost as hard as explaining what internal medicine pediatrics as a specialty is to some
Right.
people. You do clinic where you're seeing sports cases, which can be a variety of things. It can be a 12-year-old who has, sprained their ankle, hurt their knee. It could be a 35-year-old who's hurt their shoulder. It could be a high-level college athlete, professional athlete. It could even be a 60-year-old person who has knee pain and is just trying to get back into walking or Zumba classes or something like that. It's musculoskeletal medicine that doesn't require surgery. If you look at most musculoskeletal injuries, majority of them don't need surgery. And that's kind of our role in primary care sports medicine, is to help treat these what we call non-surgical injuries. And kind of one of the directions you can go is you can be a team physician for a high school, a college, professional. You can even go on and be a team physician for the Olympic team. I have several friends who were actually just in the Olympics in July in Tokyo covering, one of them was covering the swim and dive team for the USA team. So I think those are kind of what we do. After fellowship, there are several ways you can practice this. Some physicians go on to do sports medicine fellowship and then they go do primary care. So if it's a pediatrician, they go do practice pediatrics. I know you've had Hazel on previously, so
Mhm.
practicing pediatrics like she does, but then you just have a better knowledge of sports medicine. Kids get a lot of musculoskeletal injuries, so you feel more comfortable with it. Some will go on and practice their primary care specialty, but then they will be the sports medicine specialist for that clinic. So everyone that comes in with knee, shoulder, hip problems, your colleagues will say, "Hey, go see Dr. Duffaut because he's our sports specialist." And the third route is kind of what I do is you're in a specific clinic where you're just seeing sports injuries or musculoskeletal injuries. I like to say musculoskeletal because I have a lot of older patients who are like, it wasn't a sports injury. I'm not an athlete. And the way I respond is we're all athletes. We're just different levels of athletes, right? The 80-year-old who's still playing pickleball is an athlete. And the 75-year-old who just wants to do her 2 mile walk every day, still an athlete. But we're all just trying to be active and stay healthy. And that's how I feel like a lot of my role is to keep people active the best way I can by helping manage their injuries and help them recover and then get them back to activity so they can be healthy and active. Probably my senior year of high school, I had a physiology teacher who was Mr. Finn. He was amazing. There are a few people that I remember that made, and I think all of us are like this, that made big impacts in our lives. Either the direction we went helped us do through tough times. So Mr. Finn was my senior year physiology teacher, and he was amazing. He just opened my eyes to the human body and the way things work, and made me question why things are the way they are and how they move and what their function is. And that was my first kind of glimpse into medicine. Still, I was not sure. It wasn't until I graduated and I worked in the ER for a year and worked in that environment of nurses, doctors, medical assistants, radiology techs, and you saw that whole encompassing thing and how everyone was the way everything relates back to sports to me. Everyone's working as a team and caring for a person and helping them, and I thought that was the greatest thing, and I wanted to do it. Well, my both my dad's parents died pretty young. One for complications, diabetes, other of heart disease. They grew up in my dad's from New Orleans, very underserved area, and not very good health care at that time, I would say. And they didn't like going to the doctor, didn't trust doctors. And to me, as I kind of went through medicine, I was like, this is something I should do. This is what I like this path, and I can help those who aren't trustworthy of the medical field, I would say, for reasons that date very far back.
If you could go back in time and talk to your younger self in high school, what advice would you give yourself?
Get a mentor. Now that we've emphasized the importance of having a mentor,
Okay.
and I think it's not something that is seeking it out is the hard part. But once you've found that person that seems to, and it has to work, right? You can't just. I think what I found it in undergrad was they had list of mentors you could do for like specialties. And I tried, I had one. It didn't really seem to click. It wasn't
Mhm.
helpful. We didn't have a good relationship. And my next step should have been, okay, I need to work harder to find someone who either is doing what I want to do or seems to have a similar background to me. I think that would have what I should have done. And because once you have that relationship, it's not hard. It's not something that's forced. I have one mentee who is a medical student here at Drew in Los Angeles. And, once a month, the last couple of months, we've just gone out and had lunch. It's not that we're having these really formal meetings, and we just talk about what I think his, future is going to hold, what things I think he should avoid. And a lot of it is like, don't do what I did. This is what I've done. Learn from my mistakes so you don't make these mistakes.
Yeah.
And then you have that relationship so that when you need help, you can easily reach out and it's not this big stretch. It's like, hey, I need to talk. Having a rough rotation. Okay, let's meet. Let's talk. Let's just, chat it out and see how we can make things move a little easier. If there's anything I can do to help. And I wish I'd done more of that early on, along with networking. Medicine, it's all about the patient, but in reality, you find that there's so much more to medicine than patient care. The patient care is what we go into it for, but to be a part of it, being around others and networking with others helps you advance, which then helps you stay at your job, love your job, and help the patients is what you went into. At that conference I went to, they also talked about all of us go into medicine because of a passion. Everyone's passion is a
Mhm.
little different. What tends to happen though is medicine can be a grind. You go from medical school straight to residency where you're not sleeping, you're working a lot of hours, and then you become attending, and you're like, oh my gosh, what am I doing? I don't know. I'm an attending. I'm freaking out. Like wheels are spinning, and you can get to this world where you start getting so burnt out, you forget about the passion.
Mhm.
And the passion, you need to bring it back because that's why we all went into medicine. That's what makes us good doctors and to help those that we went in to help. So it's always, I think, reflecting about your passion of why you went into it and not forgetting it because it kind of grounds you back again to why you're in it